Treating TMD, temporomandibular dysfunction. Few areas of dentistry are as confusing as that for the treatment of TMD, which can be debilitating for many people. Currently, hard splints are in vogue, but having worked or lectured in all the continents around the world, I have continued to be amazed at the differences between methods and approaches to this problem. Some of them must be wrong. What possibly can be agreed on is that much of the problem stems from a difference between the positions of the jaw, A, when the teeth are in their biting position, and B, when the joint's in its balanced position, usually referred to as centric position. Dentists and orthodontists are used to moving teeth, and as such, the focus is to move the teeth so that the teeth bite in the same place as when the joint is balanced. But there is little explanation to why this difference occurs. From a postural perspective, a whole different approach seems logical and almost too simple. People who are a little short of tongue space tend to rest with their tongue between the teeth, as this is comfortable. And since this is their habitual postural position, where the mandible sits for most of the time, the jaw joint remodels to be balanced in this position. When they bite together, the joint is not centric, so is not balanced. It is overclosed, with the head of the jaw joint set in the top back of the joint, often squeezing the disc out of the way. If they bite hard or clench, possibly due to periods of stress, it is possible to cause great damage to the joint and for the disc to dislocate, worsening over time. This situation does not resolve, as the difference between the postural and the biting positions remains different. Placing a splint helps in the short term, as this makes an artificial biting position that matches the centric or postural positions. In the long term, the splint usually disturbs the postural position, often with the tongue resting between the splint and the teeth, requiring increases in the splint thickness to compensate. The next step of changing the bite to match the splint is difficult, costly, and it would seem illogical. From an orthotropic perspective, it makes more sense to change the centric position to match the biting position, especially as there's no guarantee that the centric position will not change after the bite has been changed. The treatment involves wearing an appliance all night, every night, that teaches the wearer to hold their teeth lightly together. They are taught to engage the reciprocal antagonists of the jaw closing muscles to prevent clenching. If, for at least a third of the time, the teeth are held in this position, or more if the training is effective, then the joint will recognize this point, so reorganize to take loading in this position. At the same time, both the upper and lower arches are widened a little to give a little more space for the tongue, so that it does not have to rest between the teeth and not encroach the airway.